Welcome to our YouTube channel Medical Subjects Made Easy. Today's topic is question and answer on diabetes mellitus. 1. What is the clinical definition of diabetes mellitus? Diabetes mellitus is a chronic metabolic disorder characterized by elevated blood sugar levels due to insufficient insulin production or insulin resistance. 2. What are the common clinical symptoms of diabetes mellitus? Common symptoms include frequent urination, increased thirst, unexplained weight loss, fatigue, blurred vision, and slow wound healing. 3. How is diabetes diagnosed in a laboratory setting? Diabetes can be diagnosed through a fasting plasma glucose test, oral glucose tolerance test, or glycated hemoglobin (HbA1c) test. 4. What is the normal fasting plasma glucose (FPG) level? The normal FPG level is less than 100 mg per deciliter, 5.6 mmol/L. 5. What is the diagnostic threshold for diabetes according to the FPG test? A fasting plasma glucose level of 126 mg per deciliter, 7.0 mmol/L, or higher on 2 separate occasions indicates diabetes. 6. How does the oral glucose tolerance test, OGTT, diagnose diabetes? It measures plasma glucose levels before and 2 hours after consuming a glucose-rich drink. A 2-hour plasma glucose level of 200 mg per deciliter, 11.1 mmol/L, or higher confirms diabetes. 7. What is the diagnostic threshold for diabetes according to the OGTT? A plasma glucose level of 200 mg per deciliter, 11.1 mmol/L, or higher, 2 hours after the glucose load, confirms diabetes. 8. How is diabetes diagnosed using the HbA1c test? An HbA1c level of 6.5% or higher indicates the presence of diabetes. 9. What is HbA1c? HbA1c represents the average blood glucose level over the past 2-3 months and is expressed as a percentage. 10. What is the normal range for HbA1c? The normal range for HbA1c is less than 5.7%. 11. How is diabetes mellitus treated? Diabetes is managed through lifestyle modifications, oral medications, e.g., metformin, insulin therapy, and regular blood sugar monitoring. 12. What is the recommended first-line oral medication for diabetes treatment? Metformin is considered the first-line therapy for type 2 diabetes. 13. Can diabetes be cured? At present, there is no cure for diabetes. However, it can be effectively managed with proper treatment and lifestyle changes. 14. What lifestyle modifications are recommended for diabetes management? Lifestyle modifications include regular exercise, a healthy diet, weight management, stress reduction, and not smoking. 15. How can diabetes be prevented? Diabetes can be prevented by maintaining a healthy weight, engaging in regular physical activity, following a balanced diet, and avoiding tobacco use. 16. What are the key risk factors for developing diabetes? Risk factors include family history of diabetes, obesity, sedentary lifestyle, high blood pressure, and age, 40 years or older. 17. What is the recommended blood pressure target for individuals with diabetes? The recommended blood pressure target for individuals with diabetes is below 130/80ths of a millimeter of mercury. 18. How often should individuals with diabetes monitor their blood sugar levels? Frequency of blood sugar monitoring may vary depending on the individual's treatment plan, but it is typically recommended to measure blood glucose levels multiple times per day. 19. Is diabetes more prevalent in males or females? Diabetes affects both males and females, but the prevalence is slightly higher in males. 20. What is the most common type of diabetes? Type 2 diabetes is the most common type, accounting for approximately 90% of all diagnosed cases. 21. Can gestational diabetes occur during pregnancy? Yes, gestational diabetes can occur during pregnancy. It usually resolves after delivery, but increases the risk of developing type 2 diabetes later in life. 22. Does diabetes increase the risk of cardiovascular complications? Yes, diabetes increases the risk of developing cardiovascular complications such as heart disease, stroke, and peripheral artery disease. 23. What is diabetic retinopathy? Diabetic retinopathy is a complication of diabetes that affects the blood vessels in the retina, potentially leading to vision loss. 24. How can diabetic nephropathy be detected? Diabetic nephropathy, kidney damage caused by diabetes, can be detected through urine tests to assess protein levels, albuminuria. 25. Does diabetes affect the nervous system? Yes, diabetes can affect the nervous system, leading to peripheral neuropathy, autonomic neuropathy, and other neurological complications. 26. Does diabetes increase the risk of foot ulcers and amputations? Yes, diabetes increases the risk of foot ulcers and, if left untreated, may lead to infections and possible amputations. 27. Is there a vaccine available to prevent diabetes? Currently, there is no vaccine available for preventing diabetes. 28. Can diabetes be genetically inherited? Yes, there is a genetic component to the development of diabetes. 29. Can maintaining a healthy weight help prevent diabetes? Yes, maintaining a healthy weight through regular exercise and a balanced diet can reduce the risk of developing type 2 diabetes. 30. What is the relationship between obesity and diabetes? Obesity is a significant risk factor for developing type 2 diabetes, as excess body fat can lead to insulin resistance. 31. Can stress affect blood sugar levels in individuals with diabetes? Yes, stress can cause blood sugar levels to rise in individuals with diabetes. 32. Does diabetes affect the immune system? Diabetes can impair immune function, making individuals more susceptible to infections and slower wound healing. 33. What is the glycemic index, GI? The glycemic index is a measurement that ranks carbohydrates based on their effect on blood glucose levels. 34. Are artificial sweeteners recommended for individuals with diabetes? Artificial sweeteners can be used in moderation by individuals with diabetes, but it is important to consider their overall diet and manage carbohydrate intake. 35. How often should individuals with diabetes have their eyes examined by an ophthalmologist? Individuals with diabetes should have an annual comprehensive eye examination. 36. Can diabetes affect sexual function? Yes, diabetes can contribute to sexual dysfunction, including erectile dysfunction in men. 37. Can regular physical activity help with diabetes management? Yes, regular physical activity plays a crucial role in diabetes management by improving insulin sensitivity and promoting overall health. 38. Is there a specific diet recommended for individuals with diabetes? A balanced diet, including whole grains, lean proteins, fruits, vegetables, and healthy fats, is generally recommended for individuals with diabetes. 39. How does the pancreas contribute to diabetes? In diabetes, there is either inadequate insulin production, type 1 diabetes, or the body's cells become resistant to insulin, type 2 diabetes. 40. Can certain medications increase the risk of developing diabetes? Yes, certain medications, such as corticosteroids and certain antipsychotics, can increase the risk of developing diabetes. 41. Can diabetes be managed effectively to prevent complications and maintain a good quality of life? With proper treatment, lifestyle modifications, and regular monitoring, individuals with diabetes can effectively manage their condition and minimize the risk of complications, enabling them to lead a good quality of life. If you found this video interesting, please like this video and subscribe to the channel.